And back in the 90s, he actually had to have scoliosis surgery for neuromuscular scoliosis, and that helped him a lot. But the surgery of those days is over, right? We've made tremendous leaps and bounds, and we pride ourselves on utilizing technologies when it fits the patient's best interest in a way to help them get back to their life faster.
Well, today, in honor of National Scoliosis Month, we are diving into the future of spine care, where artificial intelligence, augmented reality, and personalized implants are transforming what's possible in scoliosis surgery. So, here to walk us through it is someone on the front lines of this cutting edge approach, Dr. Ehsan Jazini. He's a spine surgeon at VSI and one of the early adopters of this technology. Dr. Jazini, thank you so much, as always, for being with us.
Thanks
Always.
for having me. Yeah,
Yeah, it's
excited
always
to be
nice
here.
to talk to you. You always bring such enlightening and insightful information. So I'm really looking forward to this conversation. Before we dive into the science of this, I want to talk to you briefly about what drew you into this work. Is there a point in your life that really, spoke to you about like jumping into spine surgery, that was your calling?
This topic really delves really well into how I got into medicine to begin with. Because my own brother, when I was 8, he was 13. We were in a really bad car wreck. He was ejected out of the car. I was sitting on his lap. Somehow, miraculously, I'm okay, and he's not. But the positive aspect of that has been that he's made tremendous strides. Right over the past 30 years, he's had over 25 surgeries at this point, and what drew me into this field is watching the surgeons, but also the therapists and the nurse practitioners and the nurses over all these years who literally lived with us, get him to the point that he is there now, and drove me to choose a field or choose a calling. Really, I don't really see this as a job that will enable me to do the same for others, and that's what drove me into this field.
Mm.
And back in the 90s, he actually had to have scoliosis surgery for neuromuscular scoliosis, which is when one part of your body is weak, you develop scoliosis because of the compensatory mechanisms involved. And that helped him a lot. But, I'm here to tell the audience and the patients I see every day that the surgery of those days is over, right? We've made tremendous leaps and bounds. At VSI, we spearhead ourselves and we pride ourselves on utilizing technologies when it fits the patient's best interest in a way to help them get back to their life faster, right? That's the key term here is how do you not only fix the problem, but with the limited downsides of surgery and with quick recovery. So it's a multifaceted approach that involves the rehab, nutrition, preconditioning, surgical techniques, technology incorporation, but also the post rehab. And how do you get the patient back to the things that they need to do for longevity, right? Because if I just fix the problem on a short term basis and say, okay, see ya, I did my job, I didn't really do my job adequately, right? I've seen that recovery with my own brother, and so
Mhm.
this topic is very salient as it relates to me from a personal standpoint as well as a professional standpoint.
I appreciate that. Thank you for sharing that story. It's very moving, and clearly, you're very passionate about this because of that firsthand experience. Unfortunately, your brother did not have the access to AI because that wasn't around when he was having his 25 plus surgeries, as you said. But what a treasure that we have this now. And I know you've been doing this for several years now. Let's start with the big picture about AI and scoliosis. What exactly is personalized spine surgery, and how is AI, artificial intelligence, and AR, augmented reality, really changing the game for patients with scoliosis?
So, personalized medicine is all about appreciating that each individual is different. There have, because of genetics, because of environment, their bony anatomy may be different. Some people are more flexible, as some people say, I'm double jointed versus I'm more stiff. These are inherent differences in the way our joints move, whether at your knees, hips, but as well as your spine. And so, what's dramatically changed over the past 10 years is the technology and the understanding has caught up with the field, believe it or not, that hey, you can't treat everyone the same way. It's not a cookie cutter. Well, we're just trying to get the spine as correct as possible irrespective of those other factors.
Mhm.
Okay, so the data and the research has been accumulating over a long period of time, right? And artificial intelligence has allowed us to then analyze huge, vast troves of data that's been collected by my peers and my mentors who've done a lot of the legwork to then help us figure out okay, for this patient with these sets of criteria, what is the right alignment that we're supposed to shoot for as a surgeon? That's part number one. And then the artificial intelligence and these other technologies like robotics then allows you to then actually translate that knowledge into an action. What I mean by that is actually get the result that you're asking for,
Mhm.
right? And then you have then the ability to then verify that you did the right thing. So that's what we have here. We have a registry to then be able to say, okay, did we really achieve what we sought out to achieve? So those are the three pillars that is personalized medicine is how do you figure out what's the right thing for the patient? What's the technology for me to figure out how to get that number? And then actually, how do you actualize it in the operating room, right? How do you get it done for the patient on the in front of you in the OR?
Well, and it makes sense because it's not, I mean, it shouldn't be one size fits all. Everybody is different. Everybody is different. So, um, how do you tailor though that treatment to each different patient? Because that's got to be difficult. Um, each spine of the segment can be treated differently. I've learned from you, but so how do you do that? How do you tailor it?
So we use advanced imaging. We use flexibility films. I'll just give you some examples. Where we're looking at the person's motion, right? And then where you're feeding that into a computer software that they develop based on the troves of data. And that's where the AI is. It says, okay, this patient is moving this amount. We know based on history of thousands of patients who are in their 20s, let's say, I'm just giving an example, with this set of criteria of this angle that you've measured, and the computer actually measures those for you now. It's kinda like full self-driving. I don't know if you've ever been in one of these Tesla cars.
Mm-hmm.
So, you're still the captain of the ship, but you're using that technology to assemble all that data to then help you as a surgeon say, "Okay, this is what that implant should look like in terms of the curvature, in terms of the number of levels," right? When I was in training, the way it was done, it was a lot of it was art of medicine,
Mm-hmm.
right? I had phenomenal mentors who had, through their experience, and it was actually really hard for them to say why they're curving this rod in this exact shape. It was basically it was like an art, right? They were basically think of like a carpenter who's building something with their hand, right? And they're trying to get that right alignment, but there was some guesswork there, right? They were getting it pretty close, but it wasn't exact science. And then once the surgery was done, then you would then days later get the X-ray and say, okay, how did I do? But at that point, the surgery's done, right? You're not going to go back unless something dramatically was done wrong. And so we've gone from an age of art of medicine was really so the supreme and experience was supreme, where we're becoming much more fine tuned in terms of our ability to get it right the first time
Mm-hmm.
and ensure that we're getting it right the first time. Right. So when I'm looking at the x ray, yes, I'm verifying that I got the right measurement, but I'm much less concerned at this point. Right. And it also saves a tremendous amount of time doing surgery. Right. Because you're not measuring and bending and redoing the work a few times to make sure you got it right. I mean, it's much more exact science because we're ordering these custom rods before the patient is even in the hospital, right? It's already in my hands
Mm-hmm.
based on all that work that we've done
Right, right.
leading up to it.
How precise are they, would you say, having done this for as many years as you have?
It's like 99.99%. I mean, it's very close to perfect,
Mm.
right?
It
The,
just
the the error rate is very low because you're using computer software that the mistake is in the measurement or in the x-ray. So the oldest technology, whatever the error rate is, that's as close as perfect as you can get. Does that
Mhm.
make sense?
Yeah, yeah, totally.
um
This must be
yeah.
really exciting for you as a surgeon to be able
Oh yeah, I mean, to me, that should be like a standard of care,
mm,
right? So The standard of care is, in my textbook, to your best of your ability, you use the technology that's going to get you the most precise um, outcome for your patient.
Right.
And I'm not talking the medical legal aspect of this. I'm really talking about what I pride myself to be a good standard of care.
So, would you say you said 99.9% precision? Give us perspective on that. Like, what with just the old way of doing things? What was it, 50-50?
No, probably around 70%, 75%, right? I mean, they were trying to get it within 10 to 15 degrees of ballpark, right?
Mm.
Now, with those sets of technologies, you would say that's over 95% because you knew that there's an inherent plus or minus 10 or 15. So it's all relative, right? To what they could achieve, that's the best they could do in their hands. So I don't want to, like my brother, for example, let's talk about his scoliosis, right? He still has a curve,
Mhm.
but they knew given that technology at the time, all they can do is get his spine for the curve not to get worse, right? They use something called Harrington rods, which is a much older system where you couldn't do the derotation of the spine and fully correct it. But I don't you can't compare that. It's like apples and oranges to what we have now. Now we can correct it. So if someone, given my brother's situation, ended up with that result now, would say that's a disaster.
Mhm.
But given what he had in front of him at the time, that was, state of the art at that time.
Yeah.
Does that make sense?
Yeah, yeah, totally. So you've now performed this surgery, I understand, over 100 times. Are there any patient stories that stand out to you?
Yeah, I it's a mother and daughter that come to mind. And this young lady had scoliosis, and because of the progression of this curve, the recommendation was we need to fix this, address this before it gets too big because we can actually limit the number of levels that needs to be fixed. It helps to minimize this progression, and she can then live a normal life, right? And in this discussion and in the process of her having surgery, I also realized her mom also has had scoliosis all her life, and because of the fear of having this type of surgery, she had put it off for years and years, so her curve was actually a lot worse. Basically, she was a living example of what happens if my current patient, her daughter, if she just didn't do anything about it, that would have been the consequence, right? Much bigger curve that spanned the entire her entire spine with years and years of pain and suffering. And it took about 2 years for her to watch her daughter, first of all, have the surgery, very successful surgery. We got the correction. She finished, middle school, high school, now she's in college and working, to then for the mom to say, "You know what? I want this to be addressed as well." Right? And then she underwent a much bigger surgery because of the magnitude of the curve with phenomenal results, right? She, is back to taking care of her kids. She has, I believe, 7 kids and, many, many grandkids. Um, and for me, it was very, gratifying to see, uh, this transition play out between the different generations and what the mom had experienced based on what she had seen her family and friends go through. She couldn't believe that same surgery where she's heard horror stories, right? I mean, if she had to have that surgery back in the 70s and 80s, right, she would be in bed rest for 3 months in a total body cast with nothing like what we could achieve, which is she was in the hospital for, I believe, 2 nights,
Mm.
and she was back to her house and back to life, right? I mean, it takes time to still recover, but that recovery is, leaps and bounds different than what was done, decades ago,
Right, right.
or even a decade ago.
Yeah, yeah. Um, I'm curious about the long-term results. Do we know yet? Because this is fairly new technology. I would
No,
assume
we
better.
have very good data on long-term results. In
Okay.
fact, all this AI technology is through the troves of data that's been collected over the past 30 to 40 years.
Mhm.
So we know that, for example, if someone is not aligned properly, let's say by 10 degrees off their center of gravity is too far forward, what the consequences and implications of that's going to be in terms of the risk of disability, in terms of the risk of further problems down the line. So we already have that data. What we didn't have was the computer software to be able to then personalize all that data and say, okay, for you in your 50s, Caucasian woman, not you,
Yeah,
um,
gotcha.
what's the right answer?
Mhm,
Right? And what can we give you what's called predictive analytics? That's what predictive analytics is using old data to then predict new information,
mhm.
a new set of facts based on that experience, right?
Right.
Before you couldn't do that because you would say, well, this research paper is not really relevant to me because they studied a Japanese population or they studied a Swedish population. It wasn't necessarily applicable to you. But when you have thousands and thousands of patients and you have the software that can do these kind of type of calculations, that's where the utility of AI comes into play.
Interesting. So, with all of these benefits, really exciting stuff here. Why are more do you know, number one, do you know what percentage of surgeons are using this? I would assume.
Less than 10, I would say less than 10%.
Whoa.
The biggest the biggest reason for that, I know it's shocking, is cost, right?
Mm,
Medical costs are astronomical in the US and around the world. In a lot of places around the world, it's not even accessible. Like I have patients coming from Canada. Not because the surgeons there aren't trained, they just don't have access to these things. So one is access. Even in the US, not all hospitals will allow you to use it because sometimes these technologies are 5x the cost,
mm,
right? So um, we have a tremendous problem in our society, obviously, with deficits and spending and budget issues. And so all of these are it's a multifactorial problem, and that's one piece of it. The other piece is surgeons by design are sort of set in their ways. It's a very apprenticeship type model. You kind of do things the way you were taught, and you try to get comfortable, and you kind of want to stay in your lane. Right? I remember one of my mentors years ago was like, you know what, like I know how to do this way. I'm sure this other technology is good, but I'm not at a point in my career where I want to change and do things any differently, right? So there comes a point where they just it's much harder. So that's another probably the second factor here where you don't see as much adoption with new technology because there is a inherent learning curve, right? It takes time to understand it. Um, Go and observe another surgeon doing it. You have to take time and energy and dedication, and you have to have that philosophy. So really, surgeons kind of come into two boats. You have surgeons who kind of um, learn it and get good at it in one way and then just keep doing the same thing over and over again. And then you have another mindset or philosophy of care, which is, okay, I got good at this, but what's next? How can I do this better? And how can I measure my own performance and always keeping an eye out for how things can be necessarily done better. The way you do that is you go to conferences, you teach other surgeons, you have you visiting surgeons come to your practice. So at VSI, every Friday, for example, we have an education day that's really meant for our staff, our PAs, and physical therapists, but also for ourselves. The surgeons have to present their cases. So they're vetting each other and figuring out, okay, is this the best way to do it? So each patient really is getting like 4 or 5 opinions at the same time,
mm.
right? And so that's how you're gonna elevate yourself by surrounding yourself with with that kind of philosophy and culture. Uh, but it takes dedication and it takes a mindset.
Yeah, yeah. Well, you certainly have that at VSI. Talk about what's next with the technology. Where is this going?
The technology is getting more fine-tuned as we get more data. So as you get more data that like ChatGPT, for example, right? It's just gonna keep, yeah, how you get these different versions that come out, I don't know, every 3 months or so. The reason there are new versions is because the neural network that they're training the data on, they're just feeding it more data and they're also feeding it more neural networks. And it's
Which
the same thing is happening with these.
the end, right?
I'm sorry?
Which makes it more precise.
Which makes it more precise, it makes it more efficient, it makes it more predictable. And so that piece of it it's just gonna keep getting better,
Mm,
okay? The other aspect is the implants are getting better. For example, disc replacement wasn't something that was even available to someone like my brother, and
mm,
so even in scoliosis, there are, moments where I can do motion preserving technology for a certain number of levels, and we can do the corrective work that we need to do for the rest of the spine, okay? For example, my brother, when they did the scoliosis correction, they stopped at the L5 vertebral body, which is at the very bottom, but not the sacrum. So now he's having a lot of pain from that bottom disc,
mm,
which is predictable. They knew that that would happen. In fact, they uh, told my parents, yeah, when he's in his 40s, he'll have problems from that disc because it just wears out. But what we can do now is, for example, is do a replacement of that bottom level, preserve the motion, fix the scoliosis, and that way 10, 20, 30 years later, they don't have to worry about that level.
mm.
And we've preserved that important level, right? So that's where the combination of technology and the surgeon really seeking these new things, new ways of doing things and techniques can make a tremendous difference for our patients.
Yeah. So, what is your advice for patients or parents who are, looking at a scoliosis surgery for themselves or for a loved one, and wondering what to do? What's your best advice for them?
I would do your research, right? And what I mean by that is the technology now out there, what's available to patients, whether it's to uh, patient groups, different types of AI models like ChatGPT. I'm just throwing ChatGPT because it's very familiar to people, but there's Gemini, Grok. There's a lot. Believe it or not, patients are coming to me with more and more understanding of their issue than I've ever seen over the past 10 years. So that's one great place to start. Second is when you get an opinion, get a second opinion or get a third opinion and ask these questions. Well, what's your philosophy of care? How many of these have you done? What are your techniques? What's changed for you in your practice? If a surgeon says, you know what, I've been doing this for 20 years and I'm great at it. I'm not saying there's anything wrong with that, but maybe that surgeon, falls into that first category that I mentioned, right? Maybe they're not really adopting new technologies, right? And this is a double-edged sword too, right? You also don't want to go to the surgeon that's defined by one technology.
Mm,
So that's another issue, right? It's like, oh, I'm the laser spine guy, or I'm the ultrasonic guy, or I'm the endoscopic guy. If you're just one guy with one technology attached to your name, that's also a red flag because to me, that tells me that the surgeon is not necessarily adept at having the whole armamentarium available to them. And they're going to just sort of look at the person and say, can I make it work with this endoscopic for this patient in my
mhm,
hands?
mhm,
And that's not a very good approach either, right? Because then that surgeon's just doing a lot of endoscopic. They may be great at it too, but that may not be the best thing for that patient.
mhm,
So you want to see someone. What you want to go away from that visit is this person cares about me. This person listens to me, but this person is very comfortable with using technology across a spectrum of different tools available to them, and they're willing to try new things, and they've and demonstrated that through their career by patient examples or reviews, right? uh and in your discussion, and if you don't get uh that good feeling, get another opinion.
So if you were having spine surgery today, or if your brother's accident had happened in this day and age, would you recommend for him to go to someone who was using
Oh,
AI?
for sure. Yeah. In fact, I had his images and everything uploaded. So my partner, Dr. Good and Dr. Haynes, took a look at him because we were trying to decide, is this the time to address his bottom disc, like I mentioned. His situation is very unique. He can barely walks with a cane. So there's a lot of other implications. Just like any other patient, it's
Mm,
okay. What's his quality of life? What are we trying to achieve? What's the goals? Right? He's not going on hikes, right? If he was a very functional person, he would have had to get this fixed a long time ago,
mm,
right? So um, that's the way I would approach it if it was my family, like I just said, or, myself actually, right?
Yeah.
Those are the way I would make a decision about who I want to see.
Yeah. Well, it makes sense. Personalization over and customization over a one size fits all approach resonates with me for sure. I think most people are seeing the benefits of this, and I really appreciate you explaining in detail how all of this works and the importance of it. Dr. Jazini, thank you as always for joining us. Spine.
Yeah, thanks for having me. This was a great discussion.
Yeah.